Welcome to this explainer. Okay, if you're a focused learner looking to finally understand what your doctor is actually talking about during your annual checkup, you are in the exact right place. I mean, we've probably all been told our entire adult lives to, watch your cholesterol, right? We hear that word and we instantly think of blocked arteries and forbidden foods. But what if I told you that everything you've assumed about cholesterol being this ultimate villain is really only half the story? Because, well, it's absolutely essential for your survival. Today, we're breaking down the real truth about cholesterol, the good, the bad, and what your numbers actually mean for your health.
So let's just dive right into it. First, we're going to look at cholesterol as the misunderstood protagonist. Then we'll introduce LDL, the delivery truck, HDL, the cleanup crew, and triglycerides, the third player. After that, we'll explore what causes an imbalance and wrap up with how to actually improve your numbers.
All right, section 1, the misunderstood protagonist, because it really isn't just a bad guy. So what even is cholesterol? Put simply, it's a fatty, kind of waxy substance found in absolutely every single cell of your body. Just think about that for a second. If it was pure poison, it literally wouldn't be a foundational building block of your cellular anatomy. It's a vital material that your body heavily relies on to function, day in and day out. It's truly essential for your survival.
Now, what's really fascinating here is where this waxy substance actually comes from. Most people assume that if you have high cholesterol, it's just because you're eating too many greasy foods. But get this, your liver actually acts as this massive cholesterol factory, producing roughly 75 to 80% of the cholesterol in your blood. Yeah, only the remaining 20% or so comes directly from the food you eat. Your body literally goes out of its way to manufacture this stuff. But why? Because it's a necessary tool. Your body needs cholesterol to build cell membranes, which keeps your cells structurally sound. It's also absolutely crucial for producing vital hormones like estrogen and testosterone. Without it, your body can't even make vitamin D from sunlight. And it actually helps digest your food by forming bile acids in your gut. So the main takeaway here is that cholesterol itself isn't the villain at all. The real issue comes down to the type of cholesterol floating around inside you and the balance between those types. Which brings us to section 2, LDL, the delivery truck, or the bad cholesterol. So LDL stands for low-density lipoprotein. This is exactly what your doctor is talking about when they mention your bad cholesterol. Let's use a metaphor here. Think of LDL as a massive fleet of delivery trucks, and they're carrying cholesterol from your liver factory out to the rest of your body where it's needed. But here's the catch. When LDL levels get too high, you suddenly have way too many delivery trucks on the road. And frankly, they get clumsy. They start dropping their cholesterol packages in the wrong places, specifically right into the walls of your arteries. Over time, all those dropped packages build up, forming thick, hard plaques in a pretty dangerous process called atherosclerosis. These plaques narrow your arteries, they severely reduce blood flow, and if one of them ruptures, well, that's what can trigger a heart attack or a stroke. So what's the goal? Well, obviously, you want fewer clumsy delivery trucks on the road. A healthy LDL level is generally below 100 milligrams per deciliter. That is a fantastic, clear target for you to beat. Now keep in mind, if you're a patient with a high cardiac risk history, your doctor might actually push you to be a bit more aggressive and get that number under 70. But generally speaking, keeping it under 100 is where you want to cap those delivery trucks. Moving on to section 3, HDL, the cleanup crew, the real hero of the story. HDL stands for high-density lipoprotein. And HDL does the exact opposite of LDL. It acts like a highly efficient street sweeper or a dedicated cleanup crew. As it circulates through your bloodstream, it's actively picking up the excess cholesterol messes left behind by those clumsy LDL delivery trucks. It loads up all those dropped packages and transports them safely right back to the liver where they get broken down and completely removed from the body. It is a vital, totally protective function. And because HDL is actively cleaning your arteries, this is the one metric where we actually want to flip the script. Higher is better. We can totally gamify this. For men, you want your HDL score above 40. For women, a healthy score is above 50. But if you can push your HDL above 60 milligrams per deciliter, man, that is considered a fantastic, deeply heart-protective score. Basically, if your doctor tells you your HDL is high, celebrate it. It means your cleanup crew is working overtime. And this brilliantly illustrates the constant internal conflict happening inside your blood vessels right this very second. On one side, your LDL delivery trucks are just trying to do their job, but when there are too many, they leave these dangerous plaque packages behind. On the other side, your heroic HDL cleanup crew is rushing in to sweep that plaque away. Your overall heart health is entirely dependent on who is winning this daily battle. All right, section 4, triglycerides, the third player in the game.
When you get a lipid panel, you are almost always going to see triglycerides listed. So, what are they? Simply put, triglycerides are a type of fat floating in your blood that basically acts as stored energy. You see, when you consume too many calories, sugary drinks, or alcohol, basically energy your body just doesn't need to use right away, your body converts those extra calories into triglycerides and just holds on to them. Now let's look at how this third player tips the scales. Medical professionals actually consider this a deadly trio. High triglycerides teaming up with low HDL and high LDL. When these three specific things align, it is strongly linked to metabolic syndrome and a severely heightened risk of heart disease. It's essentially the ultimate toxic environment for your arteries. But there is a safe target here. You want to keep your normal triglycerides below 150 milligrams per deciliter. That ensures this third player doesn't join forces with the bad cholesterol.
Part 5, the imbalance. Let's look at what actually tips the scales.
It really is the million-dollar question, right? What actually pushes your bad LDL delivery trucks up while suppressing your good HDL cleanup crews down? We've covered the medical definitions, sure, but now we need to pivot to the real-world cause and effect. Let's run through the specific culprits that ruin your balance. First up, diet definitely plays a huge role. Saturated in trans fats, so things like fried foods, processed snacks, and red meat, those directly raise your LDL. Next is physical inactivity. Just sitting all day literally drops your protective HDL levels. Smoking is another massive culprit. It damages your blood vessels directly and lowers that good HDL. Obesity, particularly excess belly fat, raises your bad LDL and those stored energy triglycerides we just talked about. But, and this is absolutely crucial to note, it isn't always just about your lifestyle choices. Biology plays a massive role here too. Genetics can totally hijack your numbers. Some people have a condition called familial hypercholesterolemia, where their LDL is dangerously high regardless of how perfectly they eat. On top of that, underlying medical conditions, things like hypothyroidism, diabetes, and kidney disease, can drastically alter your cholesterol balance. So it's a really complex mix of how we live, but also how we're built. Finally, Section 6, improving your numbers. Let's take back control. All right. Here is the absolute best news of this entire explainer. You have a massive amount of power to fight back and improve your numbers. Let's rapid fire through your best weapons here. Step 1, adjust the fuel. Eat more fiber, like oats and beans, to lower that LDL, and eat healthy fats like avocados and olive oil to boost your good HDL. Step 2, move. Literally just 30 minutes of brisk daily walking dramatically boosts your HDL cleanup crews. Step 3, quit smoking. Seriously, your HDL can actually start improving within weeks of quitting. Step 4, lose just 5 to 10% of excess weight. It sounds small, but it makes a huge measurable difference. And step 5, limit your sugar and alcohol to directly crush those floating triglycerides. These simple, everyday changes are incredibly effective. But, as we mentioned earlier, sometimes genetics are just stubborn. And if you do all the right things and your lifestyle changes still fall short, science provides an incredibly effective backup plan. Medications like statins step in to basically lower the cholesterol production right there in your liver factory. They are life-saving tools for sure, and we'll actually be decoding exactly how statins work in a future explainer. So what does this all mean? Here's your main takeaway. Cholesterol is not all bad. It is entirely about balance. You want to keep your clumsy delivery trucks low, your heroic cleanup crews high, and your stored energy triglycerides in check. If you haven't had a lipid panel test done recently, I highly, highly urge you to ask your doctor for one. It's just a simple blood test, but it will tell you exactly who is winning that battle inside your arteries right now. Thank you so much for joining me for this explainer. I want to leave you with one final question to think about. What complex health topic should we decode next? Let me know your thoughts, keep learning, and I will see you next time.